So how did you find out about Geraldine?
I had told the folks at Canvasback, the medical mission group, that if they found the right patient, maybe I could pull off obtaining airfare, obtaining volunteer services in Reading, and maybe we could make it happen. I didn't know who Geraldine was at the time. Getting this accomplished really wasn't that hard. Dr. Schwartz very much wanted to be part of this, and he even talked about traveling to Majuro, but he couldn't find the time. So when I approached him with this idea of helping Geraldine, he was very much in favor of it. And he made the inquiries at the hospital about obtaining free OR time, and he made the inquiries also about obtaining hardware. The hardware is very expensive. Since he does a lot of work at the hospital with that particular brand of hardware, they were very generous and just donated the time and the hardware.
And that's why she can't bend it, because it kind of just goes to about like that and stops because it won't go. So we have to do that, okay? And get it back into its normal position.
My butt.
This is her elbow in the dislocated position. You can see the humerus is here and the radius is here. We can bring her up over now. We've got all this mobilized and bring her back to the relocated position. So she had a huge chunk of bone back here that we had to take off, which was probably from that capitellum up there. But we can't put it back on. So there her ligament is back together. We'll do a little bit more here. Elbow frame.
That wrench, yeah.
And it's better than just casting it, because with a cast, she'll just get stiff in whatever position she's in. With this device, we're going to center it on the center of rotation of the elbow, and then she'll be able to move her arm in the device to get motion back, rather than being stiff here. But it'll still keep the elbow joint reduced. It will allow keep it from dislocating.
Doctor, Geraldine, the doctor was really proud of you, and your arm's all fixed, okay? Take some good deep breaths.
What's been the response of those who know of the situation?
People have been very generous. We have had only a few negative comments. Why her? Why not somebody from the local community? And the reality is, the folks in the Marshall Islands, particularly Geraldine, had no other option other than this. If we were not going to do this, the next orthopedic team was going to be in a year or two. By then, her elbow would have been ruined and there would have been no chance at surgery. And the reality is that most people here do have at least some options for health care.
The dentist in town stepped forward, and this dentist heard about her and just said, I want to offer free dental care.
This is called number 30, and she has a problem with number 19. So we are going to do our best. Usually this age they don't get cavity that large that would involve almost the whole coronal or crown portion of the tooth, but that's what she has, and we have to deal with whatever we can in a short time that we have.
So we just took Geraldine's external fixator off, and this is a picture of her in full flexion, and this is a picture in full extension. So she goes from about 100 degrees up to about 130, 120, 130. She can get her hand to her face, and she can use her arm in front of her. As she goes along from now forward and does some motion exercises, she'll probably get much better movement of her elbow. But she'll be pretty good within about a week or so. She should be using her arm pretty well and able to reach her face and do things with it.
Folder? Yeah.
Oh. Come on, good girl. Okay.
Are you having fun? No?
What's next?
For Geraldine, she'll be returning to Majuro, and she will be receiving physical therapy in Majuro. In the future, for this plan, what do I want to do? Where do I hope this goes? I hope people can use this example and maybe reproduce it in their community.